Imagine a disease so stealthy that it begins with a simple fever, a headache, or a feeling of fatigue. Symptoms so common they could easily be mistaken for the flu. But this is no ordinary illness. Left untreated, it progresses to something far more sinister: confusion, disrupted sleep patterns, and eventually a coma. This is human African trypanosomiasis, better known as sleeping sickness, a disease that has haunted sub-Saharan Africa for centuries. At the heart of this disease is a tiny but deadly parasite, Trypanosoma brucei. Transmitted by the bite of the tsetse fly, this parasite invades the bloodstream, then the central nervous system, wreaking havoc on the body. The tsetse fly, often found in rural areas near rivers and forests, is more than just a nuisance. It's a vector of death, responsible for spreading the disease to humans and animals alike. The symptoms of sleeping sickness unfold in two stages. In the first stage, the parasite multiplies in the blood and lymphatic system, causing fever, headaches, and joint pain. It's easy to dismiss these signs as something minor, but the second stage is where the disease earns its name. The parasite crosses the blood-brain barrier, leading to neurological damage. Patients experience confusion, poor coordination, and a disrupted sleep cycle. Hence the term sleeping sickness. Without treatment, the disease is almost always fatal. Despite its devastating effects, sleeping sickness is confined to specific regions of sub-Saharan Africa, where the tsetse fly thrives. Countries like the Democratic Republic of Congo, South Sudan, and the Central African Republic bear the brunt of this disease, often in remote, impoverished areas where healthcare is scarce. But why, in the 21st century, does such a disease still exist? The answer lies in a complex web of factors: poverty, lack of infrastructure, and the challenges of diagnosing and treating a disease in some of the most isolated parts of the world. Yet, there is hope. Over the past few decades, concerted efforts by global health organizations have dramatically reduced the number of cases. But the fight is far from over. As we delve into the story of sleeping sickness, we uncover not just the science behind the disease, but the human stories of those affected by it. What does it take to eliminate a disease that has persisted for so long? And what can we learn from this battle about the broader challenges of global health? The story of sleeping sickness is not just one of disease and despair. It's also a story of human resilience and scientific ingenuity. The first recorded outbreaks date back to the 14th century, but it wasn't until the late 19th and early 20th centuries that the disease began to be understood. In 1902, Sir David Bruce, a British microbiologist, identified the parasite Trypanosoma brucei and its link to the tsetse fly. This discovery was a turning point, but it was only the beginning of a long and difficult battle. In the early 1900s, colonial powers in Africa faced devastating epidemics of sleeping sickness. Entire villages were wiped out, and the disease became a major obstacle to economic development. In response, large-scale campaigns were launched to control the tsetse fly and treat infected populations. These efforts included clearing vegetation to destroy tsetse habitats, relocating communities away from high-risk areas, and using early drugs like atoxyl and triparsamide to treat patients. However, these early treatments were far from perfect. Atoxyl, for example, was highly toxic and could cause blindness. Triparsamide was more effective, but still had severe side effects. Despite these challenges, the campaign succeeded in reducing the number of cases significantly by the mid-20th century. For a time, it seemed that sleeping sickness might be eradicated altogether. but the disease proved stubborn. In the 1970s and 1980s, conflicts and political instability in many African countries disrupted healthcare systems and allowed sleeping sickness to resurge. The tsetse fly, once pushed back, reclaimed its territory, and the disease returned with a vengeance. By the 1990s, sleeping sickness was once again a major public health crisis, with tens of thousands of cases reported annually. The fight against sleeping sickness has always been a race against time. Diagnosing the disease requires specialized equipment and expertise, which are often unavailable in remote areas. Treatment, while effective in later stages, is complex and can be dangerous. Drugs like melarsoprol, introduced in the 1940s, could cure the disease but carried a risk of fatal side effects. Even today, while newer drugs like eflornithine and nifurtimox eflornithine combination therapy (NECT) are safer, they are still difficult to administer in resource-poor settings. Despite these challenges, there have been remarkable successes. Coordinated efforts by organizations like the World Health Organization, WHO, and non-governmental organizations have brought the number of cases down to historic lows. In 2020, fewer than 1,000 cases were reported, a testament to the power of global collaboration. Yet, the battle is far from over. The tsetse fly remains a formidable foe, and the threat of resurgence looms large. What can we learn from the past to ensure that sleeping sickness is finally eradicated? And what does this fight tell us about the broader challenges of combating neglected tropical diseases? In a world of advanced medicine and global connectivity, it's easy to assume that diseases like sleeping sickness should have been eradicated long ago. Yet, this ancient illness continues to haunt sub-Saharan Africa, particularly in some of the most remote and impoverished regions. The question is, why? One of the primary reasons is the tsetse fly itself. This insect thrives in specific environments, rural areas near rivers, forests, and savannas, where it finds the perfect conditions to breed and spread the Trypanosoma brucei parasite. Efforts to control the tsetse fly, such as insecticide spraying and traps, have been successful in some areas, but they are expensive and difficult to sustain. In regions plagued by poverty and political instability, these measures often fall short. Another major challenge is the difficulty of diagnosing and treating sleeping sickness. The early symptoms, fever, headache, and fatigue, are easily mistaken for other illnesses, delaying diagnosis until the disease has reached its more severe neurological stage. Diagnosing sleeping sickness requires specialized equipment and trained personnel, which are often unavailable in the rural areas where the disease is most prevalent. Even when diagnosed, treatment is complex. While newer drugs like eflornithine and NECT, nifurtimox eflornithine combination therapy, are more effective and safer than older treatments, they still require careful administration and follow-up, which can be a challenge in resource-limited settings. Poverty and lack of infrastructure also play a significant role. Many of the regions affected by sleeping sickness are among the poorest in the world, with limited access to healthcare, education, and basic sanitation. In these areas, people often live in close proximity to tsetse fly habitats, increasing their risk of infection. Additionally, conflicts and political instability in countries like the Democratic Republic of Congo and South Sudan have disrupted healthcare systems and made it difficult to implement effective disease control programs. Another factor is the lack of global attention and funding. Sleeping sickness is classified as a neglected tropical disease, meaning it primarily affects marginalized populations in low-income countries. As a result, it receives far less investment and research funding than diseases like malaria or HIV/AIDS. This lack of attention has slowed the development of new diagnostic tools, treatments, and prevention strategies. Despite these challenges, there is hope. Over the past 2 decades, coordinated efforts by organizations like the World Health Organization, WHO, Médecins Sans Frontières, Doctors Without Borders, and local governments have dramatically reduced the number of cases. In 2020, fewer than 1,000 cases were reported, down from tens of thousands in the 1990s. However, experts warn that this progress is fragile. If control efforts are relaxed, the disease could easily resurge. The persistence of sleeping sickness is a stark reminder of the inequalities that still exist in global health. It highlights the need for sustained investment, innovation, and collaboration to address not just this disease, but the underlying factors that allow it to thrive. As we continue to fight sleeping sickness, we must also ask ourselves, what will it take to finally eliminate this ancient scourge? The fight against sleeping sickness has come a long way, but the battle is far from over. Thanks to decades of research, innovation, and global collaboration, the number of cases has dropped dramatically, from tens of thousands in the 1990s to fewer than 1,000 in 2020. This progress is a testament to what can be achieved when the world comes together to tackle a common enemy. But the question remains, can we finally eliminate sleeping sickness for good? One of the most promising developments in recent years has been the introduction of new diagnostic tools and treatments. Rapid diagnostic tests, which can detect the disease in just 15 minutes, are now being used in remote areas, making it easier to identify and treat cases early. New drugs like fexinidazole offer a simpler and more effective treatment option, with the potential to be administered orally rather than through injections. These advancements are game changers, especially in resource-limited settings where access to healthcare is a major challenge. Another key strategy is the control of the tsetse fly. Innovative approaches, such as the use of insecticide-treated traps and targets, have proven effective in reducing tsetse populations. In some areas, sterile insect technique, ASIT, a method that involves releasing sterilized male tsetse flies to reduce reproduction, has shown promise. These efforts, combined with community education and environmental management, are helping to break the cycle of transmission. Global collaboration has also been critical to the progress made so far. Organizations like the World Health Organization, WHO, Médecins Sans Frontières, Doctors Without Borders, and the Drugs for Neglected Diseases Initiative, DNDi, have played a central role in coordinating efforts, funding research, and delivering treatments to those in need. Local governments and communities have also been essential, providing the on-the-ground expertise and manpower needed to implement control programs. However, the road to elimination is not without its challenges. Sustaining the progress made so far requires ongoing investment and commitment. In many affected regions, poverty, political instability, and weak healthcare systems continue to hinder efforts to control the disease. There is also the risk of complacency. If control efforts are relaxed, sleeping sickness could easily resurge, undoing decades of hard work. The fight against sleeping sickness is more than just a public health campaign. It's a moral imperative. This disease disproportionately affects some of the most vulnerable populations in the world, people who have already been marginalized by poverty and conflict. Eliminating sleeping sickness would not only save lives but also help to reduce inequality, and promote sustainable development in some of the world's poorest regions. As we look to the future, we are reminded of the power of human ingenuity and collaboration. The progress made so far shows that even the most daunting challenges can be overcome with determination and innovation. But the work is not done. To finally eliminate sleeping sickness, we must continue to invest in research, strengthen healthcare systems, and address the underlying social and economic factors that allow the disease to persist. The story of sleeping sickness is a story of hope, a reminder that even in the face of seemingly insurmountable odds, we have the power to create a better future. As we continue this fight, we must ask ourselves, what kind of world do we want to live in? And what are we willing to do to make it a reality?